Master the essential knowledge and legal requirements of mandated reporting to ensure you can protect those in your care. This course covers the legal requirements, responsibilities, and procedures for mandated reporting in healthcare. It prepares CNAs and healthcare workers to recognize abuse and neglect and to report these situations appropriately to protect vulnerable populations. Mandated reporting is a legal obligation for healthcare workers to report suspected cases of abuse, neglect, or exploitation involving vulnerable individuals such as patients, elders, or children. Timely and accurate reporting ensures the safety and well-being of residents and helps prevent further harm. This course details the types of abuse, legal responsibilities, reporting procedures, and CNA roles in mandated reporting. Introduction to Mandated Reporting. This module explains the purpose of mandated reporting, which is to protect residents from harm and to promote their safety and well-being. It highlights who qualifies as a mandated reporter under state and federal laws, emphasizing that failure to report suspected abuse can result in legal penalties for the healthcare worker. The module also discusses how mandated reporting fits into the broader scope of patient advocacy and healthcare ethics, reinforcing the role of CNAs as frontline defenders of resident rights. Types of abuse and neglect that must be reported. This module provides a comprehensive overview of various forms of abuse and neglect that CNAs must be vigilant about and report without delay. It covers physical abuse, intentional use of physical force causing injury or harm, such as hitting, slapping, or improper restraint. Emotional or psychological abuse, behaviors that inflict mental pain, distress, or anguish, including verbal insults, threats, humiliation, or isolation. Sexual abuse, any unwanted sexual contact or behavior, including inappropriate touching or exploitation. Neglect, failure to provide necessary care, food, shelter, hygiene, or medical treatment, leading to harm or risk. Financial exploitation, illegal or improper use of a resident's funds, property, or assets. Self-neglect, when a resident is unable to care for themselves, leading to unsafe conditions or health risks. The module teaches how these abuses may manifest and why it is critical to report even suspicions to protect residents. Legal and ethical obligations and mandated reporting. This module explores the legal frameworks and ethical imperatives guiding mandated reporting. It explains legal requirements. Laws vary by state, but generally mandate healthcare workers to report suspected abuse to authorities immediately. Ethical responsibilities. Beyond legal duty, CNAs have an ethical commitment to protect vulnerable individuals, respect their dignity, and promote safety. Consequences of non-reporting. Failure to report may lead to legal penalties, including fines, loss of licensure, or criminal charges. Reporting timelines. Immediate reporting is emphasized to prevent further harm. Confidentiality and professionalism. How to maintain resident confidentiality while fulfilling reporting duties. Recognizing signs and symptoms of abuse and neglect. Recognizing abuse requires keen observation. This module details physical, behavioral, and emotional indicators. Physical signs. Unexplained bruises, burns, fractures, or injuries inconsistent with the explanation. Behavioral signs. Withdrawal, anxiety, aggression, fearfulness, or sudden changes in mood. Neglect indicators. Poor hygiene, malnutrition, dehydration, untreated medical conditions, or unsafe living environments. Financial exploitation signs. Missing belongings, unexplained withdrawals, or changes in financial status. The module also stresses the importance of documenting observations accurately, avoiding assumptions or accusations, and understanding that some signs may indicate medical conditions requiring professional evaluation. How to report. Step-by-step procedures. Clear, step-by-step guidance is essential. This module walks learners through 1. Immediate action. Ensure resident safety. Intervene if necessary. 2. Notify supervisors. Report suspicions promptly to a nurse or supervisor per facility protocol. 3. Complete incident reports. Fill out accurate and thorough documentation detailing the incident, observations, and actions taken. 4. Follow facility and legal protocols. Know where and how to submit reports to internal authorities and, when necessary, external agencies such as Adult Protective Services (APS) or Child Protective Services (CPS). 5. Cooperate with investigations. Provide truthful information and assist in follow-up reviews while maintaining confidentiality. 6. Maintain documentation. Understand the importance of keeping secure, objective records for legal and clinical use. Protections and confidentiality for mandated reporters. Fear of retaliation can deter reporting. This module covers legal protections. Most states provide immunity from civil or criminal liability for good faith reporters. Confidentiality requirements. Reporters' identities are generally kept confidential to protect them. Handling retaliation or workplace issues. How to seek help if retaliation occurs, including reporting to higher authorities or legal counsel. Ethical commitment to privacy. Reporting must balance protecting the resident and maintaining confidentiality for all parties involved. Common challenges and how to overcome them. Mandated reporting is not always straightforward. This module discusses barriers such as fear of consequences, concerns about job security or relationships with colleagues, uncertainty about signs, doubting whether an incident qualifies as abuse, lack of knowledge, not knowing how or where to report, emotional impact, difficulty confronting or reporting colleagues or family members, overcoming challenges. Training, support systems, clear protocols, and fostering a culture of safety and transparency are essential. CNA responsibilities and best practices in mandated reporting. This final module solidifies the CNA's role by emphasizing vigilance, continuously observing and assessing residents for signs of abuse. Prompt reporting, acting quickly without delay or hesitation. Accurate documentation, writing factual, clear reports, avoiding opinions or assumptions. Respect and empathy, handling sensitive situations professionally while advocating for resident safety. Continued education, staying informed about laws, facility policies, and ethical standards related to mandated reporting. Collaboration, working with healthcare teams to ensure comprehensive protection and care. Conclusion and recap. This detailed course equips CNAs and healthcare workers with the knowledge and confidence to fulfill their mandated reporting duties effectively, protecting residents and fostering safe, ethical healthcare environments.